today I have with me Erin from our September 4 cohort, and she just finished up with the program. So I'm super excited to talk with her about her experience this last year and throughout our IONRP program. So, Erin, if you just want to start by introducing yourself a little bit, share what facility you work at, what unit you work on.
My name's Erin Schultz. I work at a smaller hospital in Waconia, Minnesota. I work on the telemetry CICU unit. I started working there a little over a year ago, year and a couple months it is now. Strictly working on the telemetry side of things, but in the next couple months I get to train into the cardiac ICU, which is super exciting.
Oh, very exciting. I love that. How were you able to apply the concepts that we covered throughout the program into your practice?
Um, I feel like things actually timed out like super well with the program. I feel like I was doing things at work and I would either vice versa come into work, have certain like complex patients, and then go into the monthly meeting or do some of the prep work and just apply it immediately. There was a lot in the beginning of the cohort where it was kind of like self-reflecting and kind of stepping back, taking a deep breath for those busy shifts especially. I feel like that came in handy. Also, some things like I would come into the Zoom meetings and learn more about whether it was like leadership or whether it was like teamwork, patient safety. And I feel like I could go into work and apply some of the things I learned from this cohort into my daily work. So there's a lot of times where I kind of like step back and think of things that I either read on or learned about and was able to apply it into just like daily life at work.
I love hearing that because that really is what the program's about. At the start, we say a lot of these things you probably learned in nursing school. We expect you to have some knowledge about it. But when you come to our cohorts, we want you to talk about like, how is your daily practice? How are you applying these things in your practice? So I love that and I also love that you found it kind of fit into the timeline too. So that's our hope as well. I know timelines look a little different for every resident, but I love that you kind of found that throughout your last year. And then, Erin, if you just want to share, so we have you do that professional experience kind of on the second half of the program. If you just kind of want to share what your topic was and focus was for that.
Yeah, so my topic had a lot of moving parts to it. So I was just focusing on this patient safety in regards to collecting vital signs prior to any type of cardiac medication administration, which one would say that's kind of common sense, but I had found out in the first couple of months of working on my unit that it happens more common than one would think and one would wish that patients are receiving like newly prescribed meds or meds they've been on for years and we're not taking appropriate vital signs or using like kind of outdated like old vital signs like they were taken an hour ago or so and we're using that when we're passing these medications or people aren't taking vitals at all and looking at like blood pressure, heart rate, or even if there are set parameters. So I had planned on auditing how well, like the compliance with fellow nurses on my unit, looking into how often we were checking vital signs, how often it was missed, seeing if there's any correlation with medication errors. Some of my personal experiences were I would have a patient, or I'd pick up a patient, or there would be a transfer to a higher level of care on our unit just because patient was getting like a diuretic or an antihypertensive. Vitals weren't taken. They didn't respond very well, like end up being hypotensive or bradycardic or some adverse event to that. So I wanted to look closer into that, see how often we're doing that. And I planned on like applying things to all units. My hospital, there's just my like tele CICU unit, a med surge, orthopedics. Just kind of wanted to make nurses aware of that. I wanted to make an educational tip sheet because there was no like when I was doing research and digging, there was no like actual procedure and policy or educational tip sheet on like certain medications that can impact this. And I feel like in the year of me working as a nurse, there's so many like different like medications, new medications. So you don't always know like what they're meant for. And it's some people don't look it up and give it. And turns out it impacts their blood pressure, heart rate. So just making like an educational tip sheet on like the most common meds, talk to I was actually in the works with a Ridgeview employee who works closely with like the Epic software. So I was planning on meeting with her again and meeting with I think it was like the CNO and one other board member, I think it was, to talk about implementing like a mandatory pop-up in Epic that makes you collect the blood pressure and heart rate. I've worked at a different hospital, or I guess with an internship, and with that, that was like a mandatory pop-up. Everybody collected it. Like it's almost like when you have like a heparin drip or something else, like you can't hit accept until all that's filled out. And then another, like I said, lots of moving pieces with this one. Another thing was parameters. I had just noticed that we're a heart cardiac unit, like we have cardiac meds all the time, and over half the time noticing there's no set parameters. So it's some nurses don't reach out about it, but like we're supposed to just reach out and clarify because every patient's vitals are individualized, and sometimes you give a beta blocker if the heart rate's less than 60. Sometimes you do, sometimes you don't. But just getting those established parameters right off the bat was kind of one of my goals.
I know I've told you this many times, but I just love this topic. And I think I love it because I've noticed in my own practice when those vitals were taken and then an adverse reaction happens for that patient. And it's happened in all settings I've worked. So not only like on the med surg unit, but also in the outpatient setting. We give a lot of diuretics and different medications for like pre-meds prior to infusions. And I know nurses are not always checking it. Sometimes I feel like even Benadryl can affect it. And it's those little meds that we're like, oh, they're fine. But maybe we should get an updated blood pressure just to make sure. So I just love that you brought attention to this topic. And I know you have hopefully many more goals to kind of go with this and continue with it. And I think you've just done a really great job starting at it. And I know you'll continue to do great. So thanks for sharing that, Erin.
Yeah.
And I am curious, what did you find to be the most beneficial aspect of the program?
I mean, there's a couple different things that I had thought of. Like, one of the bigger things was this program kind of allowed me to constantly look back and reflect on my growth as a new grad in the last year, which I thought was like super empowering and just really exciting to see. Just with like some of the journals early on, or just there was I can't remember what it was called, but we like made these goals in like the first month and then looked back on them in the last month. I'm like, oh my gosh, that's crazy. And even doing like the follow-up surveys, just like looking at my growth with that too was pretty wild. And you look back and kind of like new grad me wouldn't have thought that.
Uh-huh. I know. I know. When you start that first year of nursing, there's just so much that you're taking in. I think it's hard to even capture everything that's going on around you. So I'm a big person for self-reflection, and I love that you took that time to do that and look back on the past year. And I know we always talk about that feel good file, which is one of my favorite ways to kind of reflect on my whole career. So I've added to that throughout the years. So I think whatever works for you, it's just really important to reflect. So I love that.
Mhm.
Anything else that you would like to share with current or future residents?
I think one big thing is to go into this program with a very open mind. Like you said in the beginning, yes, we just got out of nursing school. And I admit, at first I was like, I just learned all this stuff. Like, why do I have to take another like year-long course? Even though it's not like nursing school, but I was like, what the heck is the point of this? But it's very much so like the time and effort of what you put into this program is exactly what you're going to get out in the end. So if you're coming in with these preconceived notions and um, just feeling kind of grumpy about it and not having a great attitude, you're probably not going to get much out of it. But if you can see like the bigger picture and truly apply yourself, I think you're going to get a lot out of this program.
Oh, I love that. I couldn't have said it better. Yeah, I think I've shared with you, but I was a resident in the program years ago, and I too was kind of like, oh, another thing. Like, just got done with school. Do I really need this? I don't know, but it did help me, and it was different than nursing school. It's you're in practice, you're doing the things, you're calling the doctor, you're running the rapids, you're doing the codes, and it's a lot different than nursing school when you have that person right next to you, or you're able to say, hey, the nurse, we need the nurse, because now you are the nurse. So I love that. And I think too, I love what you said about keeping an open mind too. Because like you said, we expect you to know some of these things, but it's really how can you apply it to your practice now that you are the nurse? Well, thank you so much for chatting today, and it was a joy to have you in the program.
Thank you so much.